Welcome back in. Well, if you've been staying at home during this pandemic, chances are your sleep schedule has changed. Maybe you've been taking more naps or going to bed a little bit later. Well, Dr. H. Andrew Wilson Jr. with the Pulmonary and Sleep Associates of Alabama joins us with more on how you can help improve your sleep and get a good night's rest in the middle of this pandemic. Good afternoon, Dr. Wilson.
Good to be here. Thank you.
All right, let's talk about this pandemic. I mean, this has been a unprecedented, I just call it simply crazy time for everything, working from home, and of course this has affected a lot of people's sleep patterns. Let's talk about how this is affecting folks' sleeping.
Well, it's really been a challenge on all fronts of life, but certainly sleep has been impacted as well for people. And as you say, I mean, so many people, their schedules have been disrupted. They're now working from home. They're homeschooling kids. Maybe if they lost a job, dealing with financial stress, and that's impacting their sleep. It's not uncommon that people spend a lot more time on screens now, and that'll certainly affect their body clock and make it harder to get to sleep. They may even find themselves consuming more caffeine or alcohol, and certainly those are big issues too. So there's a lot going on.
Yeah.
A lot that needs to be people need to be aware of, because it really can make a difference in their sleep quality.
Absolutely, and let's talk about some helpful things that people can do to improve their sleep during this pandemic. Again, you know, a lot of people probably dealing with this. I know myself personally, you know, my sleep pattern has changed. Of course, my schedule has changed coming here to Birmingham and to this new station. Let's talk about what people can actually do to help us out here. We're struggling, Dr. Wilson.
Yeah, well, there are several simple things, and actually came up with a little simple mnemonic, SLEEP, to kind of keep some of these things in mind. First being structure. People just have to be aware that they're not held to the same constraints that they were back when they may have had a regular job. And so it's easy to go stay up late, linger in bed, nap excessively during the day. So being aware of that, trying to stick to a schedule, particularly fixing a regular wake-up time and avoiding excessive napping. L for light, trying to minimize a lot of bright light in the evenings and trying to expose yourself to bright light in the mornings, trying to limit the blue light from screens, because that can affect your body clock. The other E, you could kind of lump exercise and eating together, because just trying to take care of yourself, eat good foods, try to limit your caffeine intake, trying to avoid excessive alcohol, trying to exercise regularly, get out and walk. The other E for emotions, being aware that a lot of people are feeling isolated, anxious, lonely perhaps, and that can impact sleep. So make a big effort to stay connected with family and friends, particularly as we get near to the holiday schedule. And lastly, P, your patience. Just be aware, okay, there is going to be an endpoint to this, and hopefully some vaccines will start rolling out in the next few months and other things, but we will get past this, so just be patient.
And very quickly, you know, as we wrap this up, Dr. Wilson, you know, what can people do to get evaluated for sleep issues during this pandemic? I believe they can come to you guys.
They can certainly come to us at our office. We're here at Brookwood Medical Center, Pulmonary and Sleep Associates, and the Brookwood Baptist website certainly has their link to sleep disorders. Many of the initial evaluations are being done virtually by Zoom and such, so that makes it easy on folks. And we are able to study patients in the sleep lab safely using the COVID-19 guidelines if the situation calls for that.
All right. Thank you so much, Dr. Wilson. We appreciate you, and we'll be back.